Level 1. The medical student. You show up to a lecture hall on a Monday morning in August. The building is not what you expected. It is not gleaming or futuristic or impressive. It is a beige auditorium with cracked seats and a projector that flickers every few minutes. There is a coffee cart outside that overcharges everyone, and nobody complains because nobody has slept enough to argue. You are 22 years old, or maybe 27, or maybe 34. It doesn't matter. Everyone starts here. Everyone starts in the same beige room, signing the same loan documents that will quietly follow you for the next 20 years. You owe close to $250,000 billion before you've treated a single patient, a number closer to what the Association of American Medical Colleges reports as the average debt load for new graduates. Your first week, you walk into the gross anatomy lab. The smell hits you before the sight does. Formaldehyde and something underneath it that you never fully get used to. You put on gloves. You look down at a body that was once someone's father or someone's daughter, and your hands shake as you make the first incision your professor asks for. For about 4 seconds, the entire weight of what you're about to become lands on your chest at once. That feeling doesn't leave. You carry it for the next 15 years. You study 80 hours a week. You memorize the Krebs cycle at 2 a.m. and forget it by 9. You take practice exams until the questions blur together, and you start dreaming in multiple choice. You fail a quiz you thought you understood, and you go home and wonder if you're the only person in the building who's ever felt this far behind. Somewhere near the end of that first year, an attending physician lets you take a patient history alone for the first time. No supervisor in the room. Just you and a stranger trusting you with their symptoms. You walk out afterward and someone tells you that you did fine, and you stand in the hallway holding a clipboard, feeling something you will spend the rest of your career trying to feel again. You don't know it yet, but that small hallway moment is the first brick in a wall that eventually leads to a room where you decide, dog, whether someone lives or dies. You just don't know that yet. Level 2. The intern. You have your white coat and your medical degree and a hospital badge with your photo on it. You are legally a doctor now. You are also acutely aware of how little you actually know. Your first night on call, a nurse pages you about a patient whose blood pressure is dropping, and you realize there is no attending standing behind you this time. The Accreditation Council for Graduate Medical Education caps your hours at 80 a week, and you hit that cap by Thursday. You run on hospital coffee and adrenaline. You present cases to attendings who ask questions you should know the answers to and sometimes don't. You lose your first patient in October. Nobody prepares you for how ordinary the room feels afterward, how the world just keeps moving. You go home, you don't tell your family, and you show up again at 5 a.m. because that's the job. You make $63,000 a year for this. Your friend from college who does marketing makes more with half the hours. You don't care, because somewhere in the exhaustion you feel yourself becoming someone your patients trust with their lives. And that trade feels, most days, worth it. Level 3. The junior resident. You scrub in for real now. You stand at the table holding a retractor for 6 hours while an attending does the actual work, and your shoulders burn, and you say nothing because complaining marks you as soft. Then one day, the attending steps back from the table and hands you the instrument. Your gloved hands are trembling under the lights. You make the incision. It isn't elegant, but it's yours. You close the wound and the attending checks your work and nods once, which is the highest praise you'll get all year. You go home and can't sleep because you keep replaying every motion, wondering what you missed. Level 4. The senior resident. You run the floor now. Interns look to you the way you once looked to your seniors. You operate with less supervision and more consequence. A patient bleeds more than expected mid-procedure, and for a few seconds, the room goes quiet except for the monitor, and you make the call that stops it. Your pay is still under $70,000. Your hours are still brutal, but something in you has shifted from following instructions to making decisions, and you can't go back to the version of yourself that only followed. Level 5. The chief resident. You teach the interns now. You say the same phrases your seniors said to you. Watch your margins. You're moving too fast. You hear their voice in your own mouth and understand that this is how the craft survives, passed hand to hand across an operating table. You are also studying for board certification, a grueling exam that determines whether the last 7 years count for anything. You pass. You are, on paper, ready. Level 6, the attending at a community hospital. You are finally the one signing the chart. No one is behind you anymore. Your first solo case is a hernia repair that should be routine and isn't. And for 90 minutes, you are entirely alone with the decision of what to do next. You finish it. You walk out of the OR and call no one, because there's no one above you left to call. You make roughly $220,000 now. And after loan payments, it doesn't feel like the number implies. You realize competence and comfort arrived on different schedules. Level 7, the attending at a major academic hospital. You've built a reputation, and now the hardest cases in the region get referred to you, patients other surgeons declined to operate on. Johns Hopkins researchers have documented that surgical outcomes improve measurably with case volume, and you understand that claim in your hands now. Not just on paper. You teach residents between cases. You publish. Your pay climbs past $400,000. But the actual reward isn't the number. It's standing over a case nobody else in the building would take and finishing it. Level 8, the chief of surgery. The hospital asks you to run the department. You still operate, but now you also decide who else gets to. You review outcomes across every surgeon under you. You sit in credentialing meetings, deciding whether a colleague's privileges should be suspended after a string of complications, knowing the decision will end a career built over 20 years. You approve protocols that will outlive your own time in the building. The weight here has nothing to do with your hands anymore. It has to do with everyone else's. You realize, standing in a conference room at 7 p.m., instead of an operating room, that the deepest form of mastery was never the surgery itself. It was learning to carry responsibility for outcomes your own hands will never touch. Level 9, the program director. You train the next generation now, deciding who is ready to operate without you in the room. You sit across from a resident who is given a decade to this and tell them they need another year before their boards. Watching their face is harder than any surgery you've performed. You also sit on the ethics committee, reviewing cases that went wrong, writing the protocols that will quietly prevent the next one. Nobody outside this hospital will ever know your name did that work. That was always the arrangement. Level 10, the retired surgeon. You perform your last case on a Thursday in March. The residents know. The scrub nurses know. Afterward, they hand you your cap, signed by everyone who ever worked a table with you. You walk out through the parking garage in street clothes for the first time in 30 years and don't quite know what to do with your hands. At home, your spouse asks how it went, and you say it went fine, and you sit on the porch the next morning at 5 a.m. out of habit, with nowhere to be. You have performed roughly 9,000 operations. You have held more lives in your hands than you can properly count, and none of them ever knew your name beyond a signature on a chart. That was always the job. Somewhere right now, a 22-year-old is sitting in a beige lecture hall signing loan paperwork with shaking hands, about to walk into a gross anatomy lab for the first time. They have no idea what the next 30 years will cost them. The debt, the sleepless nights, the years of being underpaid for the responsibility they already carry. They have no idea it will hollow them out and fill them back in with something they can never fully explain to anyone who hasn't lived it. But they'll figure it out. They always do. The cycle continues.